Hi everyone, my name is Jennifer Pilgreen. I'm doing my reflective blog for Module 3. So, of the skills described in Chapter 7 of Grohar, Murray, and Langan, the Leadership Skills Questionnaire I would use to secure needed resources such as staff include planning accordingly. I would know what the needs of the unit would be to get things accomplished and how we would get those done and with the amount of resources that were available. For example, providing ample amount of education and having rep support for all products that were being used. A lot of standing planning would be essential to keep all staff informed and involved about updates and processes. I would also address situations as they occur to implement processes for improvement and or needed education. I would plan for the unit to ensure there are adequate supplies and equipment available. I would be an organizer, both vertical and horizontal. By vertical, I would refer to my administrative staff to assure the levels can get the work done for the organization. And for horizontal, I would put things and people into groups to get work done effectively. And it all depends on what the situation is. Staffing, I would let my staff know that we're going to have adequate staffing per census, which is off of grids or whatever the organization has to conduct adequate productivity and to deliver effective care. I would be direct, I would communicate well, I would keep an open line, I would listen to their concerns in any areas for improvement. I would be understanding yet assertive, inform the staff what I expect them to be as far as accountable, responsible, and the expectations I have for the other staff. I would be confident and develop trust relationships, and I would also set goals for the unit and promote staff participation by having them involved in the goals to be set for the organization. Um, we at my organization, we went from primary nursing model to team nursing model. It was due to the nursing patient ratio, the amount of workload that was involved for the nurses, and because we were understaffed with RNs. We just couldn't get RNs. So by going to the team nursing model, we were able to improve teamwork and collaboration of patient care. We have an RN, an LPN, and an NA, or either two RNs, which one is a lead, one is a second lead, and an NA to 8 to 10 patients. Our outcomes for this were decreasing falls, improving patient satisfaction because of the amount of time that was increased for the nurse to spend with the patient, and then the education that was being provided was an increase as well. And then staff satisfaction, not having all the work of primary nursing to be put on one person, but it could be a shared collaboration. The article that I referred to was the Menifee Model for Patient-Focused Interdisciplinary Team Collaboration by Kathy Menifee. And Menifee states that interdisciplinary collaboration is essential to excellent health care. Serving in a supervisory role, I assist my nurse manager with her daily agenda. I have to stay organized, be consistent, and be prepared for meetings, and may have to provide data as needed or requested. I also assist staff as needed for bedside care. If advanced to a manager role, I believe I would function effectively. In my current role, my nurse manager involves me in multiple phases of her position. I assist with scheduling, hiring, disciplinary actions, budgeting, counseling sessions, and performance improvement processes for our unit and the organization. I order supplies and equipment. I communicate with other nurse managers and nurse leaders now. The levels and departments that I would need to work with in order to be more effective in my role include all ancillary departments: radiology, pharmacy, dietitian, case management, PT, speech therapy, occupational therapy, respiratory therapy, and physicians. I would also have to be included or taught with my staff nurses, my NAs, my secretaries, clinical leaders, supervisors, other nurse managers, my administrative director, and then, of course, my chief nursing officer. It's pretty much the entire organization. Everyone matters to make my role matter and be effective. I like the team nursing model approach over primary nursing model because nursing is about providing effective patient care, and having a team approach gives more staff that are assigned to certain tasks, yet overall promote efficient care in a timely manner. I like the organizational structure. By separating things out to perform efficiently and effective, you can reach out to multiple resources to get tasks accomplished in a needed amount of time.